Now, the World Health Organization says 413 people have been killed and over 3,000 wounded as clashes continue in Sudan. It's been 6 days since fighting broke out between the Sudanese army and the Rapid Support Forces paramilitary group. Doctors Without Borders says it's a battle to treat patients and supplies are running low. Let's get an update now from Borrie Grange. He is the spokesperson for Doctors Without Borders in Southern Africa, and he joins us virtually from here in Johannesburg. Borrie, thanks for your time. A really, really horrific picture being painted by all of the reports and stories we're hearing coming out of certain parts of Darfur. And I think I want to start by just quoting one of your colleagues, an MSF, a project coordinator, has been working with the South Hospital in Al Fasher in North Darfur. And if I could just quote very quickly, the majority of the wounded, they say, are civilians who were hit by stray bullets, and many of them are children. They have fractures caused by bullets, or they have gunshot wounds or shrapnel in their legs, their abdomen or their chest. Many need blood transfusions. There are so many patients that they are being treated on the floor in the corridors because there simply aren't enough beds to accommodate the vast number of wounded. And that's just some of what's being reported back by one of your colleagues. That picture is horrific. And this person says the situation is catastrophic. What more can you tell us about what your colleagues are experiencing on the ground in Sudan at the moment?
Yeah, so that's the eyewitness account of Cyrus Bay, project coordinator there for us at the Al Fasher Hospital. Maybe just a bit of context. So Al Fasher is in Darfur, which is an area that has a long legacy of the impact of conflict. So just to the north of the city, there's a camp for internally displaced people since the fighting in 2003. And that houses 200,000 people and high levels of malnutrition among children, inadequate supply of water and the like. So the situation prior to this escalation and fighting in Sudan for the average person has been very difficult. Medical supplies have been short since 2021 after the coup. So we've also seen an exodus of medical professionals from Sudan in that time. So this is, as he described, a catastrophic situation. That hospital that we are supporting has the capacity of 38 beds, and it used to be a maternity hospital, and that's essentially what our activities were at that stage. So we were able to quickly convert it and have 2 operating theaters to treat the wounded. But just to give a sense of the scale of the number of wounded that we're seeing, so it's 279 wounded people that have been received at that hospital in 7 days, among whom 44 have died. That's a mortality rate of about 15%, which is incredibly high. And for such a massive influx of people to seek care. And so there is really no other option but to treat people in the corridors and on the floors of these wards. Those injuries that he describes are incredibly difficult to treat if you do not have adequate supplies. What is required to treat gunshot wounds to the chest or the abdomen, definitely a steady and a reliable supply of blood to do blood transfusions, IV fluids and the like, as well as dressing kits, medicines to prevent infection and the like, and even more so when you're going to do an orthopedic surgical procedure to restore a fracture in a limb where you might need an external fixator. So these are quite complex things to try and do in very constrained environments. So the hospitals around Al Fasher, all of them have been closed because of the insecurity, the fighting, and also the fear for healthcare workers to be able to make it to those hospitals. Up until Sunday, there was no surgical capacity in Al Fasher itself. So some of the doctors that worked, or surgeons that worked at these other hospitals, were then rerouted and came to work at the Al Fasher South Hospital that we've been supporting. The good thing is we had on Tuesday an opportunity to restock the hospital, which was fortunate. There was a lull in fighting, so we were able to do that. But those supplies are not going to last very long. At the moment, with the current patient load that we're seeing, it's likely that 2-3 weeks, and then we'll be out of supplies. So if the current situation is protracted and it continues, then definitely the situation is definitely not going to get better. The other thing just to mention, though, is in Khartoum itself, other hospitals are reporting a lack of fuel for their generators. There's an intermittent electricity supply, which makes it incredibly difficult to treat patients. And I think just in addition to that is also we've seen ambulances being turned away by armed men when they're attempting to collect wounded or injured or even the dead on the streets of Khartoum. And essentially what our message to the parties of the fighting is that you should not be targeting healthcare centers. You should not be targeting civilians. Those are acts that are prohibited under international humanitarian law. Ambulances should be provided with safe passage in order to ferry the wounded and the injured to facilities.
Did the speed and the intensity of this fighting that broke out about, 4 or 5 days ago, is it that's making this situation a little bit different to other places where we've seen war break out? And I know this makes it sound so very flippant when you're dealing with the wild-scale violence that you're seeing and affecting ordinary people. But it does seem that it's very intense and it's happened very fast. And we're not even close to talking about, can we negotiate corridors for aid and healthcare to be transported? There was talk of a ceasefire on Tuesday and that collapsed very quickly. Is it the speed at which everything's happened that's caught some people unawares, and how quickly do you think we can start having those conversations about how aid and health services can be protected under the current set of circumstances?
Marcel, in the normal circumstances, hospitals will have mass casualty plans. So they will have a reasonable amount of stock available to deal with a large influx of people, be it for a traffic accident or something of the like, or let's say, for instance, blast injuries, etc. And so our teams normally would be able to have our stocks pre-positioned, our kits ready, and the like. The difficulty, though, with this is the longer the conflict continues with the scale that it has and how it's essentially paralyzed healthcare systems, prevented people from being able to access healthcare centers, is it also means that we can't travel by road to replenish those supplies from our warehouses. Neither can we fly in supplies from outside the country or within the country, even because all the airports are closed. So this is really a massive choking or a massive choke point in any kind of aid delivery. Is if there is a pervasive level of insecurity over a period of time, it makes everything so much more difficult. As soon as the fuel supplies run out in certain towns or cities, literally everything will ground to a halt. Even the generator that you would use to power the lights in a hospital or to sterilize your equipment for surgeries. So one could say that you could see similar instances during the conflict in Yemen or in Afghanistan as well. But these mass casualty or mass influxes of severely injured people is definitely a test for healthcare workers. I might just also add that the hospital that we're working out of in Al Fashir, as I mentioned, was a maternity hospital. That hospital on an average week would deal with about 30 deliveries, normal deliveries, and at least 3 to 5 cesarean sections. So when we're speaking about the injured and the sick that are either unable to come to the hospital or there's such a volume, we also need to remember that when a pregnant woman is about to give birth, that baby's not going to wait for a truce or a cessation of the fighting. That baby has to be delivered, and this is an incredibly difficult moment for women who are expecting or about to give birth, given what we've seen more generally with high mortality rates in the region.
What are you hearing about the situation on the various borders of Sudan? Because when something like this unfolds, one knows at some time we're also going to start talking about a humanitarian crisis at the borders as people then try and flee their country. Have you heard anything in that regard as yet, Borrie?
So in this instance, that doesn't appear, or we're not seeing any significant signs of population movement. I mean, for the moment, what's clear is that people are hunkering down where they're living, which also means that they are very likely to run out of whatever supply of water or food they have. They're unable to go to markets, and life has essentially come to a halt. I think it's also worthwhile that we just remember the significant impact of this at a specific time. It's the end of the holy month of Ramadan.
Yeah.
Many people were looking forward to celebrating Eid al-Fitr.